a lot of people have tried to make heads or tails of that metabolic questionnaire. And there's so many different versions of Dr. Kelly's questionnaire out that, and one of the first things the foundation that I started, called the Beth Gonzalez Foundation, tried to figure out is, okay, how can we replicate the diagnostic tools that Nick used at scale? Because one of our goals is to educate practitioners in how to do the Gonzalez protocol. We don't want to just like keep this cure for cancer in a storage unit. No, we actually want to share it with people. So the questionnaire is one of the tools that we have been perfecting. We're actually testing it statistically right now, so we can make sure that it is sound from a statistical standpoint. But that's been quite complicated, because if you've ever taken the Kelly questionnaire, I mean, first of all, the book's like this thick,
right? And
people get exhausted after like page 50. So yeah. Our questionnaire is shorter than that, and I'm fortunate in that. I guess I'm fortunate. Didn't feel so fortunate at the time, but I inherited 300 boxes from Nick's office, and as they were delivered to my home, it didn't feel very good. But fortunately, in there were some of Nick's original questionnaires that he used when he first opened up his practice. Now, over time, he used the questionnaire as more of a tool in his patient intake sessions when somebody first became his patient. So rather than having people fill it out, he would just use it as a clinical tool and ask the questions. But as he liked to say in lectures, he understood the metabolic typing so well that in time, he could pretty much figure out what your type was after a short conversation and by assessing your body type. He also used different tools like blood tests and mineral deficiency tests and hair testing to help perfect his metabolic typing.
And that's one thing I really always appreciate about his protocol, is that it's not a one size fits all. Because when I hear other, cancer coaches or cancer doctors out there and say, it's only the plant-based diet that works, or it's only carnivore that works, run the other way. That's not how it works. We're individual people, and you have to find out what works best for your body and your type. So yeah, I really appreciate that. And that's why he was getting such great results, right? Because he didn't have that cookie cutter approach that so many others have.
He didn't. And yet I'll share that for certain types of cancer, there was a similarity in the diet. So for breast cancer, for example, which I know is your specialty, his patients who had breast cancer were primarily on a heavy vegetarian diet with a lot of juices and a lot of detoxification. And of course, those pancreatic enzymes that you spoke about.
Yeah, yeah.